Yeah, very good morning, students. This is grade 7 Social and Political Life. So, in the previous chapter, we have already discussed till page number 23. So, let us have a summary of this chapter. So, now we are in chapter 2, Role of the Government in Health. Especially, this focus is on state government, right? So, we have already covered 50% of this chapter. So, today's class will be moving forward, covering the new concepts. So before starting the new concept in this chapter, so let us have a summary of previous classes so that all the students and who are joining newly will also be understanding. Okay? Yeah. So if you could see screen, it is clear that we are in the chapter 2 and we need to understand what is the title of this chapter. Role of the government in health. Okay? So which government? So we have state government, we have central government, we have local government. Right? There are three levels of government. So which government is it talking about specifically? And which government is mainly responsible for providing health and taking care of health, monitoring the health related issues. Okay, so if you could remember in the very beginning of this chapter, we discussed that there are two kind of list that state government is responsible and central government is responsible. Right? For example, army, railways, right? So we know that these two are majorly responsible of the central government, where central government has the accountability and the authority to monitor and regulate these departments. And the list goes on. There are many, there are many departments that comes under central government. At the same time, we already discussed that state government as well. For example, road transportation, RTC, and for example, police and public health care, right? So we have already had a discussion on it. So it is clearly mentioned that in this list, providing public health, providing public health, sanitization, and proper medication is the primary responsibility of the state government. Okay, of course, central government also will be providing some help, some kind of medicine or whatever is required from the central government. It will do, but ultimately it is the responsibility of the state government. Okay, so we understand. So, what is meant by health? We have already discussed. It's just going through it very speed. What is meant by health? We need to understand. So, if you see this, it is clearly mentioned that the definition of health has been clearly mentioned, right, in this chapter. If you see here, health means our ability to remain free of illness and injuries. Health means our ability to remain free of illness and injuries. Ante without getting illness or not getting injured is called health. If somebody asks you how is your health, what does it mean? How are you? What does it mean? So are you fine? What does it mean? Is your health good? Have you been injured? This is how the meaning, right? So health means the ability to remain free of illness, not getting ill and not getting injured. Okay, and at the same time, when it is told that illness, injuries, it is specifically talking about your physical health, right? And we already had a discussion about mental health as well, which related to your brain, your thinking, and your heart, right? So how are you mentally? Are you mentally healthy? That is also very important, right? So, and in this chapter we already discussed that there is a comparison saying that how our health medical science is far better than many other countries and how our medical science is rapidly growing, right? So if you see this box, the two kind of information is available. One is the left side, how effective is our medical sciences in our country, and the right side, What are the still basic problems that all Indians have been facing, right? So we already know that number of doctors, number of hospitals have been increasing this side. At the same time, even though number of doctors have been increasing, but still many of the qualified doctors will stay in the urban areas. They don't stay in rural areas. So the medical facilities, the access of medical facilities still is not available in rural areas, right? And at the same time, and the sustainability over the years, the number of hospitals have been increasing. If you see in 1950, the only 2,717 government hospitals were existing. But now in 2017, it is around 23,000 plus, right? There is a rapid growth in the number of hospitals. But what is the reality here? Though number of hospitals have been increasing, but still lack of people die from tuberculosis, TB. We have already discussed about it, and many people are fallen sick because of malaria, and many millions of the people are getting malaria, and they are facing a lot of difficulties to survive and recover from that, right? And at the same time, so India gets a large number of medical tourists. We discussed that what is medical tourist, who come as a tourist for understanding the medical facilities, the medical services that this country or the specialized hospitals have been providing to the patients. They come and observe and they study so that they will learn something new. They will understand that how other countries like India has been providing services. Okay, so one side medical tourists from other countries have been coming, but other side of the coin looks like we are not able to provide clean drinking water to all. Okay, for other countries it is a medical tourism place, but in the reality the people who are staying in this country are not being able to get a clean drinking water. And 21% of all communicable diseases, we discussed that what does it mean communicable diseases. Communicable diseases are nothing but which are contagious and which can spread from person to person. These communicable diseases are waterborne and which will come through water. If water is not drinking water, not purified water, through the water we'll get a lot of diseases like diarrhea, worms, hepatitis, right? So at the same, it is saying that India is the third largest producer of medicines in the world and is also a large exporter of medicines. We discussed that what's the case with the US during the corona lockdown. So they requested India to provide some medicine, and our country also has provided some medicine. So our country is in a third position out of many countries producing, manufacturing a lot of medicine. But at the same time, half of all the children in our India do not get adequate food to eat and are undernourished. They are not even getting adequate food. What does it mean adequate food? We know that, the food which is insufficient, which is not sufficient, right? Half of the food or 20% of the food. So this is the reality. If you observe the left side, it is saying that the development of medical sciences of India, and the right side it is showing that still the worst condition of the people living in this country. Then what's the problem? That is what we had discussed. That what it is saying, it is in India, it's often said that we are unable to provide health services for all because the government does not have enough money and facilities. After reading the above left-hand column, do you think this is true? We discussed that government has sufficient funds. If governments prioritize providing health facilities, good medicine, all the required facilities, government can do it. It is not an impossible task. It is a simply possible task for the government. It is a matter of prioritizing providing public health care. That's it, right? So we had a very good discussion on it. So let's move and try to understand. And we have already discussed about a story of Hakim Sheikh. What happened in this case? So he met an accident. He fallen from a running train. So his head was injured. He went to many government hospitals and and he was rejected, saying that they do not have a proper beds available, and there is no empty beds available, and they do not have a proper equipment. And ultimately, he had to. go and take a treatment in a private hospital, which cost him too much. Then he got angry and he got an upset over the different attitude of all the hospitals that refused him to admit him. So what happened? He filed a case in the court, right? So he filed a case in the court because none of the government hospitals could help him when he was in the position of death, and he had to go to private hospital and getting the treatment and getting cured, which cost him a lot. So he was not satisfied with the public healthcare system that is being provided in our country. So he filed a case in the court. And what happened after filing a case in the court? We need to look at. Okay. So, and after this, we also had a discussion about another story. So, which is the cost of a cure, right? So, this story is all about two students. One is Ranjan and one is Aman. So, Ranjan is the person who comes from a well-to-do family. We already know what does it mean well-to-do. Means he belongs to a rich family, and Aman is the person who comes from the very poor family, right? So what happened? Both got injured. Sorry, not injured. Both fallen sick. Okay. So what happened when they fallen sick? This Ranjan's father, he took him to a hospital which looks like a five-star hotel. And the treatment in the hospital also very nice. They were playing a music, and the nurse who came to collect the sample of his blood is talking very fun with him. He did not feel that they're giving him injections or taking blood away from him. He did not feel that because the atmosphere, the environment of that hospital looks so friendly. He did not feel that he's in a hospital. He enjoyed. But while coming to the Aman's case, he went to a government hospital because his father doesn't have the affordability to bear some cost of the expenses. So he went to a private government hospital. And what happened there? We already know that he had to stay in a queue for a long time. After stayed in a queue more than 4 to 5 hours, he got a chance of meeting the doctor. Doctor asked him to undergo some X-rays. He went and he got the report after 3 days. And we know that if you are fallen sick and your reports come after 3 days, it is very difficult, right? Because today you are fallen sick and reports will come after 3 days. You need immediate treatment right now. Otherwise, something will happen. We don't know, right? So that is the worst situation he faced. And after he received the report, he went back to the hospital, and doctor was there was a different doctor. So again, he had to explain everything, and the doctors told him and prescribed him some medicine. We know what does it mean prescribed is a suggestion by the doctor. Okay, prescribed a medicine. So finally, he got the medicine and he went. When these both Aman and Ranjan sat together and discussing about what all things happened when they went to hospital. So Ranjan told that it was a very nice hospital, and but they gave a lot of medicine. But Aman told that the hospital was not nice, but they did not give a lot of medicine. It was a very low cost. So that is a very basic difference between private hospital and the government hospital. The kind of problems that we have to face, right? Okay. So after the story, what we have done after completing the story, we have discussed that what are the problems that we face or the Ranjan faced if you stay in a private hospital. The one thing that we come up is it was expensive, cost too much, and that is the only disadvantage of going to private hospital. And one more disadvantage we all together could find out is if doctors are prescribing more medicine than the requirement, that will be more effective for the health because you are going to a getting cured from the illness and doctor is prescribing more medicine than they required. For example, if you need only one tablet per day, if they're giving 4 to 5 tablets, definitely you will get side effects. You'll get irritation, may not be feeling hungry. It is too dangerous. That is a major disadvantage if you go to private hospitals. That is what we discussed. Okay, so this is what the summary of what we have discussed so far in this chapter, right? So now, so we are going to understand, we're going to understand public and private healthcare services. What is it? Public and private healthcare services. So it is very clear for us healthcare services, and in the constitution also it is saying that it is the primary responsibility of the government, providing welfare of the ensuring the welfare of the people. So what we should understand is healthcare services is the responsibility of the government. Then why there is a public and private? And what is public and private? We need to understand. Okay. So what we will do right now is let us read every single sentence, every single word, try to understand the meanings and the intent of these paragraphs so that we will get a full clarity. Okay. So read along with me while I'm reading. You also read, understand it. If you have any doubts, we will clarify at the end of the class. Okay. So let us look at it. From the above story, you must have understood that we can roughly divide up various healthcare facilities in two categories. How many categories? From the above story. Which story is it talking about? Ranjan and Aman story. So we can roughly divide up various healthcare facilities in two categories. What are the two categories? These are the two categories, right? Public healthcare services and private healthcare services. Okay, we understood that there are two kind of healthcare services. So let's look into what is public healthcare services and what is private health facilities. Okay, so let us read it and understand what is the meaning of it. Okay, public health services. Let us read it. The public health service is a chain of health centers and hospitals run by the government. Okay, public health service is a chain of health centers and hospitals run by the government. As it, the name itself is a public, it is run by the government. It is very clear that, and these are the chain of hospitals. What does it mean, chain of hospitals? It's nothing but if you see in Bichkunda, we have an hospital. If you see in Banswada, we have an hospital. If you see in Nizamabad or Kamareddy also, we have an hospital, right? These are the chain of hospitals. If your disease is beyond the limits of the standards of this hospital, you can go to another hospital which is nearby your location. Okay, so that they will consider you that you are coming from another government hospital. They'll take you your admission and they'll start giving the treatment. These all the hospitals which are being run by the government have a link up. Okay, so that is what the meaning of chain of health centers. They are linked together. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kind of problems. As I mentioned, there are hospitals in Bichkunda as well. There is an hospital in Banswada as well. There is a hospital in Kamareddy and Nizamabad as well. These hospitals are established for the servicing of all the people. Okay, treatment to all kind of problems, from common illness to special services. Okay, common illness is nothing but getting a fever, vomiting, or a stomach pain, or these are the common headache. And the specialized is kind of something different diseases, cancer, something heart diseases. These are special diseases. So these hospitals will provide common and special services. At the village level, there are health centers where there is usually a nurse and a village health worker. At the village level, if you take an example of Bichkunda or some of the rural areas which are located in our region, these are the areas at the village level, there's a health centers. Health centers are nothing but the government hospital, small health centers. You take an example of Bichkunda. So what is written there is Pradhamika Arogya Kendram, means primary health center. Okay. So it is also in a village level. Of course, it is a mandal headquarter. But what is the situation there? There is usually a nurse and a village health worker. Okay, every time there should be a nurse and a village health worker should be available. They are trained in dealing with common illness and work under the supervision of doctors at the primary health center. Okay, for every village there should be a nurse and a health worker. At least these two people should be available for all the villages, like Dadigi, Eklara, Rajula. For every village there should be a nurse and a health worker should be available for treating the people. Okay, so these people will be monitored by the doctors who are in the primary health center. Where is the primary health center in our mandal? In our Bichkunda mandal is in the government hospital of Bichkunda. That is called PHC, Primary Health Center. Okay, there you can also find out a board saying that Pradhamika Arogya Kendram. It means that primary health center. Okay, such a center covers many villages in a rural area. At the district level is the district hospital that also supervises all the health centers. Large cities have many government hospitals, such as the one where Aman was taken, and also specialized government hospitals, such as one in Hakim Story. Okay, so what is it saying is PHC, Primary Health Center, is responsible in a rural area which covers many villages. For example, you take an example of Bichkunda Primary Health Center, Bichkunda Government Hospital. It will cover almost 20 to 30 of villages that are, that are part of Bichkunda Mandal. Okay, all the people who are part of Bichkunda Mandal will come to this hospital. This hospital can serve these 30 to 20 to 30 villages. Okay, this is how. And there are some hospitals in Nizamabad, Kamareddy, which are the district headquarters. These will cover and these will serve the district level people, almost all the mandal, urban areas, and the rural areas of the district. This is responsible for that. So this is what it is saying. Okay. So let's go to the next passage. The health service. This health service is called public for many reasons. What is it saying? The health service is called public for many reasons. What are the many reasons? Let's try to understand. In order to fulfill its commitment for providing healthcare to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Do you understand? What is it saying is the health services are called public. Why are we calling it public? Because in order to fulfill the commitment of government to provide a public healthcare services to all its citizens. That is the reason we are calling it public health services. Okay, because it is a primary responsibility of the government. That is the reason we are calling it. Okay, and also government has established these hospitals and health centers which are meant for serving people of all cadres, irrespective of their social status, whatever the status. Okay, it is meant for serving all the people. Okay, the resources needed to run these services are obtained from the money that the public. Okay, for example, let us say either in local hospitals or the district headquarters, there are many government hospitals. How do they run these hospitals? Do you think hospitals can run without money? Do you think? It is not possible, right? Why is it not possible? Because everything, let us say they need to pay current bill, they have to get medicine, they have to provide salaries, they have to use the sanitization precautionary methods, everything. They have to purchase new equipment, they have to make more staff members are available, to fulfill all the needs of these things. They need some money, right? Then who will give the money? Is it that people are giving money? Is it that government is giving money? Or where this money is coming from to run the government hospitals? Who is giving? Who do you think are giving and providing some money? It is the people, we the people paying taxes to the government. So the amount which is being collected through the taxation will be utilizing for the running government hospitals, providing services and providing some medicine, all the other facilities. Okay, it is we the people. We are paying the taxes to the government, and government is returning the money and investing the money in the public healthcare system. Okay, so we will be understanding how this money is being utilized in this passage. Okay, so let's move forward. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide equality. Sorry, it is meant to provide quality health care services either free or at a low cost so that even the poor can seek treatment. So what is the major important agenda is providing a quality healthcare services in the government hospital either for free or at a low cost. Okay, sometimes they charge some money for the medicine, for the hospital beds rent, some service charges. They'll cost some money which is comparatively low with the private hospital. Sometimes they provide free of cost. Okay, so that even the poor can seek treatment. See, disease is a disease for everybody. We don't know, it will come only for the rich people or only for the poor people. It is a disease. There is no, variation or discrimination. Anybody can get a disease. But what is the problem? If everybody will get a disease, the person who has a money can go to a better hospital, can get a better treatment. Yes, will enjoy a better facilities as well while getting the treatment. Then what about the poor? How will they get survive? Do you think it is possible? It is highly impossible for the poor people to get a proper treatment, and they cannot even go and admit in the private hospitals, right? So that's the reason. So government is taking one step forward and providing that healthcare services which are meant to provide quality. It's not that just we are providing the healthcare services. Okay, you come and take and go, and you just keep quiet whatever the treatment is being provided. It is not like that. It is meant for providing quality healthcare service. But is it really happening in reality? Is a very big question, right? We have already had a very big discussion on it. Is it really happening in reality? Is the government really providing a quality healthcare services? Let us say if it is government really providing quality healthcare services, then what is the need of going to private hospitals? If everything is being available for free or at a low cost, why do people go to private hospitals? Is it that they want to spend money just because they have a money, or because the quality is not there in the government hospital, so that people are moving to private hospital? What is the reason? So think about it. So the reason is, as we discussed in the interviews process, people are not trusting government hospitals because they feel that they don't care, and they don't even provide a quality service, and they don't even maintain a hygiene. That is what the problem, right? Then what is about providing quality healthcare service? It is the government agenda, but in reality it is not being taken forward. Then what is government doing it? We need to understand. And is there any solution for it? So in going forward in the next pages, we'll get a solution in this chapter itself. Okay. So that is what. So another important function of public healthcare is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera. Okay, it is not only about if patients are coming to hospital, they will give the treatment, and they will give some medicine. It's not only the responsibility. There is another responsibility also, which is the prevention of the spread of diseases such as TB, malaria, jaundice, cholera. Okay, so what these people have to do is these people have to go and orient the people, guide the people, how to be more neat, how to maintain. their health diet, what to do if they get this kind of symptoms, what to do if they get that kind of diseases, how not to get into that diseases. Okay, this is how government has to take a responsibility. These people who are part of healthcare services, it is their another responsibility also, prevention of spread of the diseases, same like we have already seen, right? Especially the corona is the best example to understand this. What they have done is they visited all the places. If anybody complained that then they got the symptoms of corona, immediately ASHA workers or some health workers, nurses, they immediately going, checking whether they're positive or negative. Whatever it is, they're providing some medicine and giving them some instructions and motivating them. Nothing will happen, so be confident, right? So what are they doing? Even when the patient is not coming to hospital, they are going to the patient and they are guiding the patient. They're being available for the patient. That is a major responsibility, okay, for the prevention of the spread of some diseases. How effectively is it happening is a very big question. Okay, on paper everything will be very clear. This is the responsibility, this is the priority, everything will be written. But how effectively is it happening in reality is matters. So you are already observing everything that's happening in your area. How people are being available. Are they really available, not available? What kind of services they are doing? What kind of orientation sessions they are conducting for people? Is it really happening, not happening? You know better, right? Okay. So let's come to this paragraph and try to understand it. What it's talking about? Why pay taxes to the government? Okay. We already know that we pay taxes to the government. The question is why pay taxes to the government? Why do we have to pay tax? మనం ఎందుకు ట్యాక్స్ పే చేయాలి? చేయకపోతే ఏమవుతుంది? ఓకే, చేస్తే బెనిఫిట్ ఏంటి? జస్ట్ థింక్ అబౌట్ ఇట్. టేక్ 10 seconds. Think about it. Don't follow the textbook. Use your own brain, your own thinking power. Think about it. Okay, sure. So let's read this and understand it clearly. Okay. So what is this? What is it saying? We need to understand. So let me present the screen. I think screen is not visible. Okay. Now the screen is visible. Okay, clear. So government uses tax money for providing many public services for the benefit of all citizens. Some services such as defense, police, judicial system, highways, etc. benefit of all citizens. Otherwise, the citizens cannot organize these services for themselves. Right? For example, there is no defense, there is no army. Government is not providing, this kind of services. They are not setting up army. Can we set up army at the border ourselves? Is it possible? Do you think it is possible? We have a different opinions. Different kind of people are there. Do you think many services, highways, judicial system, do you think we can organize for ourselves? Is it possible? Though we try to organize, people who have some influence, who are more power, they will misuse it, right? So that's the reason we need an organization who can act on behalf of the people. So that's what government is doing, right? So what government is doing is government uses tax money Tax money is money which is collected through the taxation. Okay, through the taxation. This money government will use for many public services. Why don't they have to provide public services? For the benefit of the citizens, right? So who is public? People are the public. If they are saying that we are providing public service, it means that they are serving the people. Then only it can be a public service. Okay. So some services such as defense, police, judicial system, highways, etc. So benefit of all citizens. So what it is doing is it is providing the above services. Okay. Taxes fund developmental programs and services such as education, healthcare, employment, social welfare, vocational training, etc. Okay, so what is it saying? Through the funds which are collected as a tax, they are using for the developmental programs. What does it mean, developmental programs? To develop something, to develop some areas, to develop some condition of something, right? How are they doing? Let's look into it. So what is the developmental program such as education? Okay. What is a developmental program? Education. Okay. What they are doing is they will be providing some teacher trainings. They are providing some free textbooks. They're providing midday meals. We had a very good discussion in the chapter one. What had happened in Telangana, sorry, Tamil Nadu, in one of the district called Veluru. The midday meal scheme has started in Tamil Nadu so that people, students are coming to school regularly, staying in the school regularly, so that Supreme Court had asked all the state governments to start the same scheme within a 6 working months, right? So this is how, after implementation of that program, there is a development in the education. At the same time, healthcare during the corona, we might have observed that what government has done, providing sanitizations, masks, some money to the people, and public distribution system, some rice, dal, whatever it is, right? And the employment as well. Social welfare. What is social welfare? Now, providing some welfare schemes, some facilities for the social development of the people who are backward. Okay, and vocational training. What does it mean? Vocational training is nothing but providing a training to the people who do not have a job, so that what they will do in the training is they will enhance the skill. They will enhance the skill of the people, and they will get the people ready for joining any better jobs, so that with the existing skill they can go and get a job. That is called the vocational training. Simply, you know, enhancing the skills, professional skills of the people, and required for needy citizens. Right? These are the things which government is providing through the taxation fund for the needy people. Who are the needy people? Who needs it? Right. So tax money is utilized for relief and rehabilitation in case of natural disasters such as floods, earthquakes, tsunami, etc. Right. So this taxation money is also used for relief and rehabilitation. For example, this is the very best example. In the last 3 months back or 2 months back, floods came in Hyderabad. So what happened? Many lower farming areas and లోతట్టు ప్రాంతాలు, the water came into their houses. Some of the houses buildings fallen down, right? So they could not stay back in that houses. For them, government must provide some quarters, some temporary houses, so that they can stay back. And if any person in that water flow might have injured, got injured, right, government has to immediately take them to rehabilitation. Rehabilitation is nothing but taking you back to the farmer situation. Farmer is nothing but a రైతు కాదు, farmer అంటే back situation. For example, during the floods, if people got injured and they will be taken to the rehabilitation center, so the injured people will get recovered, so that they will back to their position. Earlier they can work, now also they can work. Okay, ఇంజూర్ అయిన people ని రికవర్ చేసే ఏరియాని రీహాబిలిటేషన్ సెంటర్ అంటాం. Okay, so that they will back to their previous position and they can work or whatever their abilities are, right? So and not only for the disasters, and it will also be using for space, nuclear, and missile programs are also funded from the revenues collected as taxes. Okay, space, nuclear, and missile. You might have seen in the last academic year there was a huge discussion about Chandrayaan 2. What was it about? It's going to the space, right? So for that kind of programs also, government will provide funding from the money that is collected through the taxation. Okay, that is how government is utilizing the funds or the money that is collected through the taxation. Okay, and government provides some services, especially for the poor who cannot afford to purchase them from the market. One example is healthcare. Okay, so what the government is doing? Government provides some services, especially for the poor. What kind of services the government is providing, especially for the poor? Have you seen any kind of services? Think about it. One kind of service is providing healthcare. What are the other services that government is providing for the people who cannot afford it? Okay, so this is the homework for you all. You need to answer this question. What kind of the other services that government is providing to the poor people? Okay, what kind of the other services that government is providing for the poor people from the money that they are collecting from the taxation? Okay, so please read the rest of the chapter, and it is very important. Okay, the rest of the chapter will be covering in the next class. Okay, until then, answer the question which is given as a homework. So thank you all for joining. Bye bye.